Head of the Pharmaceutical Board of Trinidad and Tobago, Andrew Rahaman, is urging citizens to stop the abuse of emergency contraception pills. These type of pills are used to block pregnancy, but can do harm if not used properly. Marie Hull reports.
Commonly called the morning after pill, emergency contraception pills, according to PlannedParenthood.com, act as a safe and effective way to prevent pregnancy up to 5 days after unprotected sex. Its function is to delay the release of an egg or ovulation. But President of the Pharmaceutical Board of Trinidad and Tobago, Andrew Rahaman, believes these pills should not be used as a routine method of birth control.
There is a particular drug which is an emergency contraceptive, and we are finding a lot of abuse. It is not recommended. There's a single dose one, and it is not recommended to be used more than twice in a particular month. So for 2 episodes of unprotected sex, that is recommendation. There is a double dose tablet, equally not recommended for more than 2 uses in a month, which will be equivalent to 4 tablets.
Mr. Rahaman recommends that if the emergency pill is needed at regular intervals, that person should consider everyday birth control.
We have no problems with the public using the normal monthly oral contraceptives. Some go for injectable contraceptives, which will last 3 months. But the emergency one, we are imploring the public. I cannot tell you at this point, I don't recall what could be the ill effects, but for safety reasons, I am sure it is for safety reasons, the emergency ones are to be used for emergency.
The World Health Organization maintains that emergency contraceptive pills are not the same as abortion pills and will not terminate any existing pregnancies. When asked if more control measures are needed to stop the abuse of this kind of drug, Mr. Rahaman notes that prescriptions are usually required, but
we have no problems with the public using the normal monthly oral contraceptives. Some go for injectable contraceptives, which will last 3 months. But the emergency one, we are imploring the public. I cannot tell you at this point, I don't recall what could be the ill effects, but for safety reasons, I am sure it is for safety reasons, the emergency ones are to be used for emergency.
The head of the Pharmacy Board stresses that personal care of one's body is important. Marie Hull, TTT News.